Good job. What was that? What was that? Yeah.
I decided to come to Nemours for residency because I first started as a medical student, and when I came, I just completely fell in love with everything about Nemours. Initially, when I was thinking about doing pediatrics, the first thing I wanted to do is come for a rotation here and kind of see why people were kind of raving about it and telling me such good things.
I was looking for a medium-sized program where it was large enough that I would get to see a broad range of diagnoses, but small enough that I still felt like I could bring something personally to the program. It wasn't just sort of another number.
Because it had all the advantages of the specialists that you get at a big program with kind of the personal feeling that you get at a lot of the smaller programs.
When you're going through the application process and choosing a residency program, everyone will kind of talk to you about the fit and finding where you fit. And I think, here is really a great, unique place.
I interviewed at many, many different residencies, and there is definitely something special here.
I walked in and just felt this sense of joy, of happiness. The residents seemed happy and really taken care of, and like they were taking care of each other.
All of the attendings took the time to get to know me. The residents also kind of took me under their wing to teach me that I was important as well.
They were all incredibly supportive, caring, knowledgeable, and I knew I wanted to be a part of that team.
Residency is definitely going to be one of the toughest 3 years of your life, no matter where you go. And when you come here, you get a sense of that this is really more than just a place to work. It's a family and a community.
And it really just felt like home to me.
One of the things that I was really impressed by was that so many of the faculty were former residents, and I think that speaks so much about a program. So like how happy they are and how awesome it is to be at Nemours.
I just felt like it was a chance to continue to stay a part of something and become one of the mentors that I had, kind of give back in the way that those mentors had given to me.
It's such an honor to have the opportunity to train other people. I'm one person, but through teaching other people to become physicians, I'm really taking care of many people in the world.
Our program is very resident-centered. They take care of just about every patient here in the hospital. And so they are the first ones to touch the patient, and they're the first ones to comfort the patient and family.
I've been waiting for you.
We have amazing patients. Those are always our best teachers, are the patients, and we do have patients that come from all over this area, really all over the country.
What Nemours is about is giving kids and families the care they need and want when they need and want it. It's really about a personal experience for the family.
I think the residents feel it. I think they realize that they're a part of something special. They're a part of an interdisciplinary team that allows for better outcomes.
The environment here is academic. It is challenging. They work very hard, but along the way, you'll always have the support of faculty, of nursing, of every person that you come in contact with.
There are not many places where you're going to get a family atmosphere, a community atmosphere, and an academic high level of medicine going on.
I think the most important thing you should know about our program is that it will prepare you for whatever type of pediatrician you want to become.
Our residents have the opportunity to spend some time here, the Tertiary Care Children's Hospital, but they also have the opportunity to spend some time up at Jefferson, which is affiliated with Sidney Kimmel Medical College, and they also have an opportunity to spend some time at Christiana Hospital, which is the busiest birthing center in the state of Delaware.
From rural Wilmington to inner city Philly, you get to see so many different things. The patient population is really unique, and you don't feel like you're missing out on anything.
Here at Jefferson, we are the pediatric department for the whole entire hospital. We also have a large refugee clinic. A lot of our residents do their continuity clinic here.
I had babies that I picked up as newborns my intern year. I'm the only one they've ever seen, and so that has really helped shape the pediatrician that I'll be, but also helped to confirm what I want to do for the rest of my career.
I actually say that's one of the biggest benefits of this program is that you get 3 different experiences.
That's really cool.
Is that cool? I also felt like the education was really prioritized here, and the fact that we have protected conference time where you can't be interrupted, by cell phone or with their pages and things like that, and the attendings are just so excited to teach.
People make learning a lot of fun.
They want to make sure that we're taking time not only to learn, but making sure that we're eating and staying healthy.
We have a very large resident lounge. That's a space for just the residents.
We have amazing resident retreats. The residents get to go away and have 2 days of bonding with their classes.
You want to do research, the hospital has funding to get residents to a conference if they are presenting their research work.
I do get jazzed when a resident goes to a meeting and says, you know, they've sort of changed their life course.
We're very fortunate to have people surrounding us who are excited and happy to jump in when you find that passion.
You're probably going to find someone willing to take you under their wing and help you mature and develop into what you're looking for.
And it's definitely a first name kind of place, although sometimes I still want to call it all these endings by their last names.
They are world-renowned, they are established, acclaimed attendings, but they are very down-to-earth, very friendly, and you feel very comfortable talking to them directly about things. You don't have to go through a fellow or talk to someone else to get in touch with the attending.
I see it as all of the residents that I work with are going to be my colleagues in the next few years.
Our residents are second to none. I love working with our residents. I learn so much from them. We have had residents active in creating protocols that we use on the inpatient side. Our residents easily find jobs. They match well in terms of their fellowships. They're coveted in the pediatric community.
And that, I think, really speaks to the fact that our residents are not only hard workers, they're not only clinically competent, but they're also wonderful people.
If you're considering applying to this program, we are looking for someone who is outgoing and someone who would be fun to work with.
We really look for people who will bring their own unique flavor to that mix, because I think that's what makes a residency program work best. So definitely people that know how to lean upon other people and also be leaned on.
Somebody who's enthusiastic, an enthusiastic learner who's going to go home and read about their patients and come back and teach other people.
Somebody who's willing to go the extra mile on behalf of a patient, a family, or their colleague.
Because I've made some of the best friends of my life.
I think building that foundation of support is really what launches me into my career as a pediatrician.
I think that Nemours is a hidden gem. It's not a place that people hear a lot about, but once you learn about it and once you come to visit, you fall in love.
Every morning I wake up and I'm excited to go to work. That love for patient care and love for the people that we work with is definitely contagious. This program helps me become the pediatrician that I want to be.
Can I have a high five?